Welcome, everyone. As you know, we are a Swiss East African company, so we are very, very punctual. This is the Swiss side of us. And now we have 15 past the hour, so I think we take the opportunity also to start this webinar session. I'm very happy and super excited to kick this off. It's actually a series of webinars that we plan at Circleg targeting health professionals, such as you are here in the audience. And the aim is really to start a discussion in different topics in the sector of prosthetics, and to talk with these different experts and to share different perspectives on topics. And we are really happy to start to kick this off with the first webinar that carries the title Cost versus Value, Making Informed Choices in Prosthetic Care. We chose to start with this specific title because in our perspective, it's a really central part of what prosthetic care or the prosthetic field is dealing with. And many of the stakeholders deal a lot with cost, price, and value. And we thought it's really interesting to take this as a start. At the same time, Circleg has started with this topic in mind: cost, affordability, and accessibility. So for the ones who don't know Circleg yet, I want to make a quick introduction before I then dive into the topic and introduce our guest of today, that I'm really happy that they're here. So Circleg is a prosthetic manufacturer and accessibility innovator. We are a Swiss East African company, and we really try to bring prosthetic care to the 90% who currently lack access. And we try to do that through product innovation, through customer service, and through community empowerment. So we really believe we need to look beyond prosthetics, the product, to really have an impact in the field. And that's why I'm super, super excited to today look at this topic from different perspectives. And funnily enough, we have two guests today, but several perspectives at the same time. Because the first guest that I want to introduce today is Dr. Alex Munyambabazi. Sorry, Alex, long name. And what is interesting about Alex, he summarizes different perspectives in one person. So Alex is a medical doctor. He is the founder of ASNU, the amputee self-help network in Uganda. He is an amputee himself, so he has a lot of experience firsthand what it means to deal with prosthetics, and he's a rehabilitation expert. And I'm really happy that you're here today, Alex, and bring in all these perspectives. Welcome.
Thank you. I'm happy to be here. Thank you for having me.
And then the second guest, I'm also very happy because I work with her very closely every day. She's a co-founder of Circleg as well. And her role specifically is business representative. Her name is Laura Magni. Welcome. Thanks again that you're here today.
Thank you very much, Simon. I'm also very happy to have this conversation together.
Great. And before we dive into the topic, last but not least, my name is Simon. I'm also one of the 5 co-founders. I'm a marketing representative at Circleg, and I would say my personal motivation is really to bring prosthetic care to the next level. And that's why I'm so happy to be here and discuss the topic with you. And we will structure the session in a way that we first have a discussion around different topics. I will also break down cost versus value in different chapters, so that's easy to digest and we can really reflect from different angles. And in the end, I would love to give you, the audience, the opportunity to ask some questions, because that's definitely also the interesting part and part of the reason why we create these webinars. So I really want to start now with the discussion and with the first question that I want to ask you, Alex. So in your work, in your daily work, and also in your experience as an amputee, what are the most common cost-related barriers that you or people face when trying to access prosthetics?
Thank you, Simon. That's a very interesting question. I am mostly based in Uganda. That's where I work with most of the amputees. And Uganda, like very many other low-income and middle-income countries, face the same problems when it comes to assistive technology or prosthetics. And these barriers are kind of multifaceted in nature. The first barrier is usually the direct financial cost, where the amputee needs cash to go and get a prosthetic leg. And right now, we all know that most of these people cannot afford that. There is also an issue of transport. For example, in Uganda, most of the centers that provide services are based in the cities, and most of these people cannot even afford transport to get to that place, to the place where they are supposed to get the services. There is an issue of maintenance. Sometimes the products which are on market are not good standard, and therefore when a person gets it, they tend to go back over and over again to the center for it to be repaired, which eventually makes it very, very expensive. Then, of course, when someone loses a leg, we all know that they are most likely not going to continue working for the time they will be in recovery, for the time they will go for fitting. And that is also a big barrier, because then someone who has a family, they are not able to provide for them. So you'll find that some people will choose not to actually go for a prosthetic and stay on the crutches, which also affect how they work, rather than just going for a prosthetic and have to face all those costs.
Wow, yeah, I see there's a lot of challenges linked to the costs. And maybe it's important also to say, when we talk about costs, it always depends which perspective, right? So the cost for the users in the end is the price. We talked there about the price and what price they need to pay in order to access the services. So actually what you mentioned last, I think it's really interesting when you say, okay, what are actually the consequences the amputees face or the users face regarding these challenges that you just mentioned?
So, of course, with these challenges, I mean, someone is going to end up choosing to decide to go for either a very cheap product, or they will just go for one that is being provided for free. So eventually they have no choice in the product they have to use. And in my experience, that affects the general well-being of the user, because then they don't feel like they are using what they deserve or what they chose to use. So that, and it is a big effect. It might sound minor, but eventually it is a very, very big impact on the patient.
Yeah, absolutely. It's really interesting also that you mentioned that, because in the end, I think what all of us try to do is trying to make the life of the users as good as possible, to increase their quality of life. And to then talk about the consequences, it's really interesting. Now I would love to hear from Laura this perspective also from Circleg, because I know we deal a lot with prosthetists, but also amputees in our daily life. In your experience, what are most of the misconceptions of these people when it comes to costs?
Yeah, thanks a lot for the question. And it's very interesting to reflect after all this interaction about exactly what are like the common misconception or things that are popping up all the time. And one of these I would like to address is actually to think cost actually disconnected from a long-term value. Or like, let's say, it can be also durability, it can be a return on investment in terms of course, financial level, but also personal level, which is like the level of your health and your social interaction, your freedom of mobility and moving and actually connecting. And I think like that's not often considered. So we think, okay, this is the only thing I'm actually gonna decide on is the price of a prosthetics, the upfront price of a prosthetics. And this doesn't give you often a big picture, because when we put a price into a timeline, then it becomes very interesting, the conversation. If you look maybe at the first month, of course, you have paid a little bit more, maybe for a slightly or a higher quality prosthetics. But if we look maybe in 3 years, you will see that your first decision of really paying for a very cheap component, thinking this is the only thing I'm actually affording, down the line, you have paid maybe 2-3 times what you would have paid for a slightly more expensive system. So this is definitely one of the things we often have to deal, and understanding that is actually one of the concerns, both for our beneficiaries, but also for prosthetists, because at the end they're also the one facing the beneficiaries. And then maybe another thing that comes to my mind is like comparing systems only on price. So thinking, okay, these are considered, let's say, affordable prosthetics. Okay, let's really like the one that wins is the one that is the cheapest. But then again, let's link it to the benefit, and let's really do a more informed decision when we really understand what is one component or one system compared to another one. So these are some of the misconceptions we face on a daily basis that we try to tackle, and it always from our side comes down also to education, or really knowledge about prosthetics and rehabilitation, for example, assistive technology, in this case, prosthetics. That taking actually a decision from a low with low information ends up often not to be the best, and the best and even the most affordable decision actually on a longer term.
Yeah, here you touch, I think, on many different points. We have now already different criteria on the table. We have price, we have durability, we have value. And you said like there is a lot of misconceptions also around that. And now my follow-up question would be, how does Circleg address this?
Yes, I mean, I think it's really in the core of our work, and how we have started this company and how we are bringing it forward. Can you still hear me?
Yes.
Yes, perfect. So that's the thing, it's really shifting the conversation from actually price and cost only. I mean, this is a super important part of the whole picture that we also want to discuss deeper. But it's really like, before talking about only price, let's really look at the value of it. And this goes back to the way we have designed, for example, the Circleg prosthetics. It was very much, the focus was, we want to bridge the gap where, first of all, there is a standards of quality that every amputee should have access to. And this is the non-negotiable. But then what can we do as manufacturers and as a suppliers to make it the most affordable in the ratio quality and affordability? And there you can do actually a lot of things. And it was our challenge, but always also our fun, I would say, for example, during the development, thinking of, okay, how can we make, so what an amputee is, and what prosthetists and actually organizations and hospitals do they need to solve as challenges, right? And we can talk about actually the quality of the prosthetics, going from durability, quality, comfort. So the way the Circleg has been designed, taking into account all of that. That's why also the different components have been designed together. The foot giving actually a good stability, a good rollover, being actually not a dynamic foot with certain type of materials, the shape, the cover, the same things with the knee, very stable. We think about the context, right, where people need to walk on different terrains and so on. So there is a side that is very much functionality related. Then also, if we think about amputees or beneficiaries, we thought, okay, they really want something that they feel comfortable and confident to show. So the aesthetic part was extremely important, because it's to really give confidence and empowerment. Now, empower is a little bit at the base of all of these. But then we can also talk about for the prosthetist, for example, it needs to be easy to fit, easy also to procure, of course, and supporting, for example, the whole fitting and shaping process. So that's why we have actually parts that are standard, but at the same time, the prosthetist with the basic knowledge can adapt it to the individual legs or features. As well, trying to, for example, for a prosthetic, for the cosmetic cover, reduce the time that they would spend in fitting a cosmetic cover, as well as the for example, making an environment, because it's already pre-shaped, they don't need to work with dust or with maybe also substance that could harm their health. And then there is a big part, I would say, that is more focusing on the institution themselves, especially when we talk about maybe challenges with the import taxation at the like low budget inventory. And there we really also thought, okay, how can we support them in needing, for example, to stock just a few numbers in order to be able to fit all the amputees, for example, without the need of having this, like, depending on the foot size, enough inventory stock, or for example, left and right. Some that are they use Circleg, they know that probably this is one of also the key features, especially when you talk with the hospital management, it helps a lot the conversation. But also, for example, we are based in Kenya. So for all the East African community, we are really responsive. Of course, it's already on site. We can deliver it in a reasonable time as well. We have the stock in house, so you don't need to wait so long. Often there is not additional taxation on it. And I think another important part is the whole emphasis we put also in training and really supporting with the right knowledge, and also to make sure that at the end it's a win-win situation. We support you on having very good technologies, but at the same time we support you with material or like information that you can also pass this value point to your beneficiary or to your customer, which will be at the end also amputees. So this is a little bit a summary of some of very specific related maybe to the product and the services that we provide or we taught at Circleg.
Yeah, thanks a lot. I mean, you opened now many worlds, and actually what you also did, and I think that's really interesting, we already started shifting the conversation from price and cost to what value do you get out of this price and this cost. And I mean, a question that I also hear often is like, yeah, but there's still a lot of people who cannot afford, price is still very important. But now maybe I would love to hear from Alex, from your perspective as a medical doctor, but also as an amputee. How would you define a value of a prosthetic, and what is a valuable product for you?
Wow, that's an interesting one. To me, really, the value of a prosthetic leg goes way far beyond its cost in terms of cash. Because I mean, the value comes with what the user gets out of this prosthetic leg, or what it contributes on this person's life. Because the prosthetic that restores function, that brings back the dignity of the person, that empowers social and economic reintegration of that person back into life, cannot really be valued like we rate value and cost. To me, it is invariable. And all this comes with how the prosthetic fits you, how comfortable it is, how durable it is, how long you're going to use it throughout its lifetime. How does the prosthetic look? Do I wake up in the morning and I'm comfortable to put it on? Does it serve the goals to why I got it? To me, that's what the value of a prosthetic leg is. Money is not really what all this means, but rather what I get out of it. And we shouldn't just look at a prosthetic leg as an aid to help us walk again. It should be beyond that. It should be, do I feel comfortable? Am I still able to go out? Am I still able to do my work without having to think about it, to think about the prosthetic leg? It needs to bring me closer to when I was before I lost my leg. So to me, that's the value of a prosthetic leg.
Yeah, thanks a lot for that. Really interesting. Because in the daily conversation, how also I perceive it, like all of these qualities get often overlooked, and the main discussion is about price, of course, because it's a very important aspect, and many people need the means also to pay for it. So maybe that's again a question to Laura. I mean, you said already how Circleg approaches affordability beyond the price, you know, like what kind of initiatives Circleg does. But I would love for you to speak a little bit about the long-term benefits that, from your perspective, often get overlooked when people talk too narrowly about price in the beginning.
Yes, I mean, I think it's also Alex who mentioned many of these things. Like, it's actually at the end is what the user and the beneficiary is able to do. Because to be honest, also if we think on a higher level, like when someone, instead of being empowered, you know, and being fully back into society, I mean, for an adult, maybe going back to work and being able to support himself first and the families and so on. At the end, even for a government and so on, it's going to be a constant expenses. I mean, I don't like to talk about only on that way, but at the same time, you don't allow the freedom of this person and the freedom of really contributing to society. So I feel like it's very, of course, on a personal level, for an individual, it's definitely not empowering, and it's not fulfilling if you have imagined something that is always like painful, or that you need to go back and repair all the time and so on. You spend your life focusing more on that than actually living your life. You're in this constant loop where you need to think how to afford this next repair, or where to go, or and so on and so forth. I think Alex is really good at talking about it. But if we think broader, then it has a very big effect, that instead of having individuals that are really like, empowered in this society and contribute, we have them being an expenses for everyone and also for families, instead of actually being more the supporters.
Yeah, so
I don't know if
yeah, no, you completely answered the question. I think we are also talking about systemic support, right? In that sense, looking at the bigger picture of what prosthetic care is, not just on one aspect of it, which is the prosthetic component itself. And I think now we established that, okay, there's the cost, there's the price, but there's a lot of value that you can gain out of that. And the question now is, what is lacking at the moment? Why do people or customers, consumers not see the value? Where is the blocker there? The question first to Laura.
I mean, this is a very broad question, and has many. I don't think there is one reason why this is a challenge, right? I think it depends on the level we're talking about. I mean, definitely there is an issue on the systemic level. Because if we put all the responsibilities only on the beneficiary, for example, that he needs to fully afford the thing and the system, and actually being the only one responsible for its own health, then of course on that side, that's the big issue, that probably still the good quality prosthetics sometimes on an upfront level are a bit too expensive maybe, or this is one, but especially if we isolate an individual. Often I believe beneficiaries are isolated, so it's even harder to think about creative solution, or how maybe, for example, just to fundraise for this money. And that's why Circleg brings in, for example, the element of community, because by connections you can definitely find way more solution to something that maybe alone you think you are not able to solve. So this is how we work there in that level. But then, to be honest, we also need to talk about the higher level, where there is no standards of prosthetics, so everything is accepted. So actually we create a mentality for the users where, okay, these are all the options, some of them are even for free, but the standards are not there, and they're still accepted into the country. So we are not promoting also on a higher level what is the standard and the quality we accept for individuals. And also, so there is a level of defining standards, and also a level, I feel, of really giving focus to education. Education in terms of course, spreading the right knowledge and the old picture of what rehabilitation means and what should be, but also really spending time on, money and resources on bringing higher the level of education of the professionals, also for our prosthetists, for example, in the countries, where then they can really support, also they can make themselves first informed decision, and then can really support the users in making informed decisions. And then I think there is also a bit of an issue maybe on also related to the to the financial aspect, that we really need to push and lobby for having actually the insurance and health insurance system covering the whole part of the rehabilitation. In some countries at the moment, it's covered only the part of amputation, for example, but this is not supporting actually the person to be back into the society fully. Like, if there is not this knowledge that amputation requires a certain follow-up and a certain action after it, if you really want to support your citizen and the people, then you need to think about the whole rehabilitation process, and not just cut it in steps and support some of them only.
Thanks a lot. Really, really important points that you mentioned. To summarize, for me, the keywords there are quality standards, community, knowledge transfer, and systemic change that you mentioned now as a last point. That I absolutely agree. We need to shift towards also support from a systemic level, so that we can really have an impact on a larger scale. So the word that comes to my mind is an innovation on all levels. And I want to ask now, Alex, from your experience, also from ASNU, the Amputee Self-Help Network, what role does innovation also in community awareness play when we talk about accessibility to prosthetic care?
I think innovation, especially looking at the local perspective, because we focus so much on imported solutions. But I think if we focus on local innovation, that can really reduce it can reduce the cost by using the locally available materials, training the local technicians, developing modular and adjustable systems. All that, I think, can help to reduce the costs, but while still serving the needs that are within the context of the areas we want to serve. That's one of the things, because I've realized that, for example, Uganda has been dependent so much on NGOs, on people who are supplying used components, on NGOs that came here to support like landmine survivors. And when they all shipped out, the country had no solution on how to deal with the amputees they had. So I think if if we can also like advocate and ensure that these systems set within the healthcare systems, local designers are trained, are empowered to also start creating and creating their own solutions. I think that would also reduce value. On the issue of community awareness and how it improves access, for sure, I've seen that community awareness plays a big role in creating awareness and access. When you go to the hospitals like I do to meet like the new amputees, most of them sometimes they don't even know where to go. They don't even know how to get help. But then and they are also scared of, when I go back to the community, how will people look at me? What we usually call stigma. But when you create awareness, when you advocate for accessibility and they get to understand that these systems are there, when the hospitals have clear referral pathways of an amputee has been in the hospital, they have been amputated, next step after recovery, they go here, then we are going to ease accessibility. But beyond that, advocacy and making sure that the people that make decisions, the policymakers, get to understand that these are solutions that are essential to the well-being of these amputees, and they should not be looked at as the last resort, because they are as important as any other healthcare needs that everyone needs.
Yeah, wow, thanks a lot for this overview. One keyword that stuck with me that you just said is local innovation. And I know that for Circleg, this is the core of also what we do. We put the users in the center, users and the planet, looking at what is the best solution for the whole picture instead of just one group of people. This goes to Laura. My question is, how, in your perspective, how has Circleg's innovation changed this approach and maybe also benefited the users in the process?
Yes, I mean, I think innovation is definitely a word we like, and we try to really like discover at Circleg in how we do many different things from of course the how we have created the prosthetic system, but also, as you said, the local innovation has been, or like the local relationship and really presence has been absolutely key in the whole history, I mean, of Circleg. I mean, I think it's by bringing, of course, or like developing an idea, but then really like confronting it with the local context, which means like with, in this case for sure, with the amputees, with the prosthetists, it's the way we actually develop the whole Circleg, the Circleg mission and vision, as well with the context, so how our things are working and so on. This allowed us with the time to really understand how to approach, for example, the complex sector of prosthetics, and which type of partnerships, for example, really focus on and bringing forward, which type of activities. I think at Circleg, we are not, it's not that at the beginning we had a vision and this is the way we are developing. It's a continuous evolution, depends on what are the main initiatives, how maybe even the government are responding, what are actually the need at the moment. So yes. I think it's innovation and local innovation. I totally agree, which is a key word, and can really like it entails a lot of things. And one of the example is again like community, like without really like engaging the beneficiaries into what is the need and what is this transformation. It would be very difficult to stay up to date actually with the current needs in the different countries and and centers.
Yeah, absolutely. So we have now we open up another topic of actually the importance of teamwork and collaboration. And so looking at the complexity of what prosthetic care is and how many stakeholders are also involved in just fitting an amputee in a very high quality way, we see that there needs to be a lot of partners collaborating. Otherwise, we cannot find the solution that benefits in the end the customers, but also the users. So looking at the future, Alex, when you could have one wish, what do you think should change according to the situation that we have now, and how you envision the future in that sense?
I think the biggest challenge we have, which is like I mentioned at the beginning, which is mostly affecting the low and middle income countries, or the global south, is that we do not have prosthetics or assistive technology in general. The needs are not integrated in the healthcare systems. Therefore, usually there is no dedicated budget for that in most of the countries, which takes us back to the barriers we had of accessibility in terms of cost and all. So my really big wish would be to see our countries, our healthcare systems embracing the fact that prosthetics, assistive technology is an essential care. It should be a human right. It's not a luxury. It's something that should be looked at, because when you read in the literature, at least everyone is bound to use assistive technology at some point in their life. And with the numbers shooting up, increasing because of the different diseases, the wars happening, the increased traffic accidents, it's the right time for the healthcare systems to look at it and ensure that it's integrated in their budget. There is money put aside specifically for these devices, because they are life-changing. They change people's lives. And to do that, ask the people who are in the space, who are providing these services, who meet the beneficiaries firsthand, who understand their pain, the pain they go through, the pain of using dilapidated illnesses, back pain, scoliosis, because someone cannot change a prosthetic and they are using it over time when it is already spoiled. It is us to create this advocacy, create this awareness, and through like these webinars, we can really, I believe we can create something different, and these policymakers are going to listen, and eventually we shall get where we need to be.
Great statement. Thanks a lot for these points. I think it's really interesting also, and I would love to come back a bit to the title of this webinar, which is cost versus value. And I feel like we established now that the conversation should shift much more towards what is the value that we actually get out of it, instead of just revolving around the price or the cost. Because then you can actually do informed choices in prosthetic care. My question now, I imagine now the audience really asks, how can we do that in daily life? How can we implement that in daily life? That's why my question to Laura: how can stakeholders, be it governments, customers, hospitals, individuals, help to shift this conversation from cost to value in prosthetic care?
Yeah, that's a very nice question. And exactly, every stakeholders, I feel, can contribute completely. And I think we talked a little bit about government. Like, there are many things. One is the health coverage that can be done, and really focusing on education and really defining the standards. So this is, I think, it's of course a long-term run, even though the steps are happening hopefully daily. So this is definitely one thing. But I feel like there is like, so also maybe on a higher level, could be like thinking about donors, because we are still in a space where there are money coming in specifically for impact focused projects, or for making sure that especially the one that really cannot afford at all can have a chance, and so on. And I think in that sense, it would be very interesting to have donors that really understand impact, the long-term impact, that they spend maybe a bit more time to really assess what a certain technology versus another, or a certain project versus another can really bring to the table, and being like the pioneer of something that becomes sustainable. Ideally, afterwards, actually, the system, the market, the person becomes independent. In the sense, I think often if you give a very good first solution, the person will be independent, because we'll start again to work, we'll start to be part of society, and so on and so forth. So how can we transform and really shift these fundings that are available through certain type of organizations to be really a catalyst for a certain type of impact that then becomes sustainable on its own? This would be a very interesting focus and conversation to have with key organizations in the sector. And then I think for amputees, to be honest, or beneficiaries, would really be like, I would really love, I mean, my side, but I think also it's a sort of like vision to see very empowered beneficiaries that go around and they feel confident to show also their prosthetic device, because they feel it's just something that allows them to live a fulfilling life. And also the whole topic of, for example, stigmatization, is becoming slower, like, is changing, like, where actually we are talking more about we don't talk anymore about disability, but we talk about empowerment through different, for example, assistive technology. So also this can be extremely strong when, of course, the device needs to be comfortable, it needs to be nice to look and so on, and needs to allow you to live in an empowerful life. So we go always back to the base needs to be there and good. But especially also what Alex is doing with the ASNO and so on, having way more amputees that they feel empowered and they can actually spread the world. And I feel also prosthetists, like that they really show through the care of their work, and they understand the impact that they can have, and they can really like push the quality of prosthetic care through their services and through their daily work, actually, to the next step, really pushing for a certain quality in their services and in the technologies. And I think manufacturers can also improve it, trying to push for always making more accessible solutions, but not negotiating on quality. So really, maybe there as well, collaborating with different organizations and so on, to make sure that there is education, there is knowledge sharing, and so on. And at the same time, there is a continuous also improvement of the also of the products that people have accessible, and more options. We think Circleg is one of the options. I think we are a good option. We are, but one of the options that should be in the sector, not just the only one. But we want to be a little bit of a role model on what is the type of standards and quality that should be available in to the beneficiaries and to the field.
So a call for quality, a big call for quality, and for shifting the conversation towards value as well. That all the stakeholders start more talking about, okay, what is actually the value we can provide to the people and to the partners as well. And I think that's a very interesting key message to take away. Now, before we go into the Q&A session and close the panel, I would love, Alex, from you, a last statement. What is the message you want to give to the audience in terms of cost versus value?
Thank you. To me, really, like, first of all, a prosthetic leg restores someone's life in general. And we should not focus on the cost. when we are having this conversation, because cost should not really define the value of the product I'm getting. Because as we said earlier, value is what the prosthetic brings to someone's life. The freedom, the dignity, the purpose, the ability to go to work, the ability to go back to school, the mental health part of it, the social integration, the confidence, the whole picture, restoring someone's life as a whole, not just looking at its mobility. To me, that is the general value. And when we focus on just how much this assistive technology costs, then we miss out on the value it brings to the human being as a whole, and only focus on replacing the missing part. To me, that is the final message, and that's how we should look at assistive technology in terms of value and cost.
Thanks a lot, Alex. Yeah, I mean, really strong message, and I would love to continue this conversation for much longer, to be honest, because I think it's really interesting and needed. But I would also love to give the space now to the audience to ask questions and give inputs from their side, to bring the discussion also forward, and in the whole spirit of teamwork to think together, how can we together shift the conversation from cost to value. In that sense, please write the questions in the chat, or you can also open up your mic and just speak. The floor is yours to the audience.
I think there is already one in the chats.
Yes, I've seen it. Thanks a lot, Roland, for the question. So he says he's from Cameroon and ask where he can get the components in his country. This is a question I believe that I want to give to Laura.
Thank you very much, Roland, for asking. So at the moment, we are not currently working like already a lot with Cameroon, but for us, it's exactly this a very good way to start a collaboration. I don't know if you're a prosthetist or an MPDs or a beneficiaries, but I would say we sell directly actually to P&O centers and to hospitals where there is an orthopedic workshop and clinic. So the best would actually be through your orthopedic workshop if you are a prosthetist, or if you're an MPDs, if you know any hospitals that provide prosthetic services, to connect us with. You're a prosthetist, yeah. Then I don't know if you work already. You are working actually through your. To your center. You can also, for example, write us through the website. For example, we have let's say an email directly to the customer service part, and we are happy to and working with our center. Yeah, exactly. And then we are happy to see what possibilities are to ship and to provide actually prosthetics to Cameroon.
Thanks a lot, Laura, for this answer. And I mean, maybe can add, we are anyways always open to receive requests. In that sense, we have like the email that you can reach out to, sales@circleg.world. We have the website that you can find the contact details as well. So anytime, feel free to reach out to the team as well. Any other questions to Alex or Laura at this point? Feel free to just ask. If you don't have any questions, okay. So hi, I enjoy being here from Kenya. How can amputees in the rural areas be supported in getting prosthetics in terms of knowledge and distance? That's a very interesting question. You can decide who wants to answer. I think both of you have really, really good inputs in that. Maybe Laura, you start, and then Alex, you can chip in.
Yes. Also, for you, I mean, we are present in Kenya in different regions and different counties, and we work already with different centers. So I would say the best would be if you actually contact us, and then we can tell you what is the closest center, for example. And our partners, we work already since like months or almost a year with some of them. So they're really like, they know a lot about Circleg and they can really provide you also the services required. So the best would be to get in touch with us and then we can refer it to our key partners that is closest to you.
I think to add on that, amputees in rural areas and how they can access the prosthetics and the knowledge about prosthetics. We also have amputee communities, as we said earlier. Circleg has a branch of the company and it has very many amputees in the group. So I believe you can still reach out and have amputees registered to the community so that they get to share all the knowledge about prosthetics they need and also discuss the other aspects of being an amputee, psychosocial support and all, because the resources are there and we would love for every amputee to be holistically rehabilitated, not just focusing on the prosthetic. So if you have amputees, I think we have a community leader in Kenya who is also an amputee, and having them join the community there would also be important.
Yeah, thanks a lot for this question. I just wanted to add as well, community is really a focus point of Circleg because we really believe you need to look at the whole package. So for instance, what we do once a month is also psychosocial support sessions virtually where people can participate. And these exchanges in our experience really change everything because suddenly you talk to people who have the same experiences, suddenly you feel seen, you feel understood, and you have the basic knowledge also what to do. So we try also to push that on different levels. And what I also want to add, we have currently the first campaign in Kenya live that is big billboards where amputees are represented. And we did this because representation is a big part of fighting stigmatization and showing that there's people out there that look like me and people feel seen, people feel understood. So we try also to address these parts with the different campaigns we do. And as Alex suggested, please reach out to us. You can also go to the website and sign up for the community. Or hand it to the persons who really need it. But thanks a lot for this question. It's a really good point. How we can also broaden access. Any other questions? If we don't have any other questions, I would like, before I close this session, I would like to ask one a final message from the side of Laura. What is your takeaway message that you want to give to the audience today in terms of cost versus value?
Yeah, I would say that, I mean, it resonates a lot with what Alex said before. Like when you think about cost, think really like in the big picture. Don't think only upfront price, but think really what is your return on investment in actually this investment, which is of course financially, but also it's about your life as a beneficiaries. And I would really wish for the prosthetists and the healthcare practitioner to really support amputees to make this informed decision, to really like understand what do they need and would they like to refine through, for example, the support of a rehabilitation and a prosthetic system, and support them to make informed decisions that really look at their big picture and really what they can gain and which benefits they could take advantage of if they have really a quality prosthetic system. And I think we all need to work together to pass this message. And as Alex said, to make sure that we have this quality and standards and this is a right, and it's not an option. It's really that someone can access that.
Powerful statement. Thanks a lot. We had a really, really interesting conversation today, and I would quickly love to summarize the key points that I felt came out of today's conversation. So what really, really stuck out is quality standards. We need to talk about quality when we talk about prosthetic care. We need to talk about knowledge transfer. How do people know about this quality? How can they access information? And who does this knowledge transfer? Then a big word was also community, talking about community of users, of amputees, how they can support each other, how they can access knowledge, but also community of prosthetists with the keyword of collaboration and teamwork, where we try to lift up each other and support each other in shifting this conversation from just price to value. Another point was systemic changes. Let's push together that the quality standards in the entire field raise a new level. And for this, we need to include governments, we need to include institutions, but we also need to work on a personal level. And I think that's a beautiful takeaway message from today. Every one of us can start to shift this conversation towards value on their level, on their stage. Prosthetists can start to talk about the benefits of value long-term with the users. The users can talk about the value in their own experience and share it with the people. Manufacturers can start talking about value and increasing the value of services and product, so that also the governments come in and see this value, and then collaborations can start. So with that, I think also local innovation comes to play, that you two both mentioned today, that we need to keep on innovating locally, not being dependent on outside solutions, and be actually empowered. This is also a word that we heard a lot today. And empowerment leads also to creating awareness and fighting stigmatization and discrimination. And I think all of this together is a really, really powerful message. And with that, I would also love to close the session today with the outlook that we will have more webinars in this series, that we really want to share knowledge from experts and key stakeholders in the field with the audience. And so you can stay tuned. You can follow our channels on social media. You can go to our website also to stay updated. And with that, I would love to thank a lot Alex for your contribution, and Laura as well. It was a really, really interesting discussion, at least for me. I hope also for the audience. And yeah, with that, I wish you a wonderful evening, and see you in the next webinar. Thanks a lot.
Thanks.